Hello friend, welcome to my channel Social Share Education. In this video, I will write essay on World Pharmacists Day. Introduction. World Pharmacists Day is celebrated annually on 25th September, recognizing the significant role that pharmacists play in ensuring global health and well-being. The International Pharmaceutical Federation, FIP, established this day in 2009 to raise awareness about the vital work pharmacists do in improving healthcare outcomes. The theme for 2024, Pharmacists, Meeting Global Health Needs, reflects the evolving responsibilities of pharmacists as key healthcare providers who go beyond dispensing medicines, contributing to global public health initiatives, disease prevention, and patient-centered care. In an era where healthcare systems are becoming increasingly complex, the role of pharmacists is expanding. Pharmacists are not only responsible for ensuring the safe and effective use of medications, but they also play a crucial role in addressing global health challenges, such as access to essential medicines, managing chronic diseases, combating antimicrobial resistance, and responding to pandemics. This essay explores how pharmacists are meeting global health needs, their evolving roles in healthcare, and the challenges and opportunities they face in today's interconnected world. The role of pharmacists in global health. Pharmacists are integral to the healthcare ecosystem, working at the intersection of medicine, science, and patient care. Their responsibilities have evolved far beyond simply dispensing medications. Pharmacists now provide a wide range of services, from medication therapy management to health education, disease prevention, and even direct patient care in clinical settings. This evolution reflects the growing recognition of pharmacists as essential healthcare professionals capable of addressing both individual and public health needs. 1. Improving access to medicines. One of the most pressing global health challenges is ensuring equitable access to essential medicines. Pharmacists are instrumental in achieving this goal. They work in diverse settings, from community pharmacies to hospitals, rural health centers, and humanitarian organizations, ensuring that patients, regardless of their location, have access to safe and effective medications. In resource-limited settings, pharmacists often play a critical role in managing the supply chain, ensuring that medicines are available, affordable, and of high quality. Pharmacists also contribute to global efforts to improve the availability of essential medicines by working with governments and international organizations to develop policies that promote access to life-saving drugs, particularly for vulnerable populations. In many countries, pharmacists are involved in formulating national drug policies, ensuring that essential medicines are prioritized and made available through public health programs. 2. Managing chronic diseases. The global burden of chronic diseases, such as diabetes, cardiovascular diseases, and respiratory disorders, is increasing rapidly. Pharmacists are well positioned to help manage these conditions by providing medication counseling, monitoring treatment outcomes, and educating patients on lifestyle modifications. Through medication therapy management, MTM, pharmacists ensure that patients adhere to their prescribed therapies, optimize their treatment regimens, and avoid potential drug interactions. For instance, pharmacists play a crucial role in managing diabetes by educating patients about insulin administration, dietary choices, and blood sugar monitoring. They also assist in the management of hypertension by ensuring that patients understand the importance of medication adherence and lifestyle changes. By collaborating with other healthcare professionals, pharmacists help reduce the burden of chronic diseases and improve patients' quality of life. 3. Combating antimicrobial resistance. Antimicrobial resistance, AMR, is a significant global health threat that undermines the effectiveness of antibiotics, antivirals, and antifungals. Pharmacists are at the forefront of efforts to combat AMR by promoting the responsible use of antimicrobial medications. They educate patients on the importance of completing prescribed antibiotic courses, discourage the misuse of antibiotics for viral infections, and advocate for the use of narrow-spectrum antibiotics when appropriate. Pharmacists also work closely with physicians and other healthcare providers to implement antimicrobial stewardship programs, ASPs, in hospitals and community settings. These programs aim to optimize the use of antimicrobials, reduce the emergence of resistant strains, and ensure that patients receive the most appropriate treatment for their infections. Through these efforts, pharmacists play a crucial role in preserving the effectiveness of antimicrobials for future generations. 4. Responding to pandemics and public health emergencies. The COVID-19 pandemic highlighted the critical role pharmacists play in responding to public health emergencies. Throughout the pandemic, pharmacists worked on the front lines, ensuring the continued supply of essential medicines, providing immunizations, and educating the public on infection prevention measures. In many countries, pharmacists administered COVID-19 vaccines, expanded their scope of practice to offer diagnostic testing, and served as trusted sources of information for patients and communities. Beyond the pandemic, pharmacists continue to play a pivotal role in preparing for and responding to other public health emergencies, such as outbreaks of infectious diseases, natural disasters, and humanitarian crises. Their ability to manage medication distribution, provide emergency supplies, and offer health education makes them indispensable in times of crisis. Evolving roles of pharmacists in global health. As the healthcare landscape changes, so too does the role of the pharmacist. Several trends are shaping the future of pharmacy practice, with pharmacists taking on new responsibilities and expanding their scope of practice to meet global health needs. 1. Pharmacists as health educators and counselors. Pharmacists are increasingly recognized as health educators who play a critical role in promoting public health. They provide valuable health information to patients, helping them understand their medications, manage chronic diseases, and adopt healthier lifestyles. Pharmacists also offer advice on preventive care, including vaccinations, smoking cessation, and dietary modifications. In many countries, pharmacists are becoming more involved in preventive healthcare services, such as administering vaccines and conducting health screenings for conditions like hypertension, diabetes, and cholesterol levels. By offering these services, pharmacists help reduce the burden on healthcare systems, prevent the progression of chronic diseases, and improve overall public health outcomes. 2. Pharmacists in clinical settings. Pharmacists are increasingly integrated into clinical teams, working alongside physicians, nurses, and other healthcare professionals to provide direct patient care. In hospitals, clinical pharmacists play a vital role in optimizing medication therapy, preventing adverse drug events, and ensuring that patients receive the most appropriate treatments for their conditions. They also contribute to the development of treatment protocols, participate in rounds, and offer medication consultations to healthcare providers. This shift towards clinical pharmacy is particularly important in the management of complex and high-risk patients, such as those with multiple chronic conditions, polypharmacy, or in critical care settings. By working collaboratively with other healthcare professionals, pharmacists enhance patient outcomes and improve the quality of care. 3. Pharmacists in research and innovation. Pharmacists are also at the forefront of research and innovation in healthcare. They contribute to the development of new medications, conduct clinical trials, and participate in pharmaceutical research that advances medical knowledge. Pharmacists are involved in research on drug safety, efficacy, and interactions, ensuring that new therapies meet the highest standards of quality and safety. In addition to research, pharmacists are increasingly involved in the development of digital health technologies, such as medication management apps, telepharmacy services, and electronic health records (EHR) systems. These innovations improve patient care, enhance medication adherence, and streamline healthcare delivery, ultimately contributing to better health outcomes. Challenges and opportunities. While pharmacists are playing an increasingly important role in meeting global health needs, they also face several challenges. One of the key challenges is the need for greater recognition and integration of pharmacists into healthcare systems. In many countries, pharmacists are still underutilized and face barriers to expanding their scope of practice, such as restrictive regulations or limited access to healthcare settings. Another challenge is the growing demand for pharmacy services, particularly in light of the increasing burden of chronic diseases and the need for comprehensive medication management. Pharmacists must adapt to these demands by expanding their skill sets, embracing new technologies, and advocating for policy changes that enable them to take on more responsibilities. However, these challenges also present significant opportunities for the pharmacy profession. As healthcare systems evolve, pharmacists have the potential to become even more integral to the delivery of care. By expanding their roles in public health, clinical care, research, and innovation, pharmacists can continue to meet global health needs and contribute to improving health outcomes worldwide. Conclusion: World Pharmacists Day serves as a reminder of the essential role pharmacists play in meeting global health needs. As healthcare professionals, pharmacists are at the forefront of efforts to improve access to medicines, manage chronic diseases, combat antimicrobial resistance, and respond to public health emergencies. Their evolving roles in health education, clinical care, research, and innovation demonstrate their growing importance in addressing the complex health challenges of the 21st century. As we celebrate the contributions of pharmacists on this special day, it is important to recognize the opportunities that lie ahead. By continuing to expand their roles and integrate their expertise into healthcare systems, pharmacists can make an even greater impact on global health and contribute to a healthier, more equitable world. Thank you for valuable time.